In this video, we will be identifying major structures of the heart using an axial CT. We will be identifying major vessels such as the aorta and superior vena cava, as well as the chambers of the heart. We will not be discussing smaller structures such as the coronary arteries during this video, since this presentation is just to give you an overview of the major structures. Please consult your lecture materials on those structures, in addition to the plastinated hearts in the anatomy lab. There are two high-yield images I'll spend a lot of time on in this presentation, and I'll mention those once we arrive at them. Here's just a reminder before we start on what type of view we're using in this image set, and I'll just circle that plane right now in yellow. We're going to be using an axial or transverse cut. We're going to start superiorly and then continue inferiorly, identifying some structures and landmarks along the way. Let's first identify three things. We have the arch of the aorta, which I'll circle right now in red, the superior vena cava, which I'll circle right now in blue, as well as the trachea, which I'll circle in green. Remember that the trachea appears black on the inside due to the presence of air, which shows up black on a CT. I've added a cartoon image on the right to give you an idea how superior to the heart we are right now, so let me go ahead and draw a line that shows where we are cutting through. And that would include both the superior vena cava and the arch of the aorta in our CT image. So I'll go ahead and draw that line for you right now in black. Again, we're cutting through the superior vena cava and the arch of the aorta. I quickly want to mention that you can see the trachea has now divided into the two primary bronchi. I'll just circle those very quickly here in green. The aortic arch has now separated into two different structures. These are the ascending, which I'll circle right here in red, and the descending, which I'll circle right here in purple, portions of the aorta. The superior vena cava, as you can see, hasn't changed, and let me outline that in blue for you right now. Let's orient ourselves again with the same cartoon image. Keep in mind that this image does not show the descending aorta, but remember that it runs posterior to the heart. So I need to draw a line that cuts through the superior vena cava and the ascending and descending aorta. So I'll draw that right about here. A new structure is coming into view, which I'll circle right here in blue. So let's look at our cartoon image and figure out what it is. Remember that we've moved slightly inferior to where we could see the superior vena cava and the ascending and descending aorta all at the same time. So the structure that we see must be, if I draw a line in black right here, it'll be the beginning of the pulmonary trunk. The left pulmonary artery is coming into view here, and I'll outline that in blue. Let's scroll through a few more images to find the right pulmonary artery, and when that is visible, we'll orient ourselves again. Now we can see the right pulmonary artery, and I'll outline that in blue as well. Let's orient ourselves again. We passed the left pulmonary artery earlier, so we must be right about here. We can still see the ascending aorta and the superior vena cava, just not the left pulmonary artery. This is the first of the two high-yield images I mentioned in the beginning of the presentation. Here is a new structure where the pulmonary trunk used to be, and I'll circle that in orange. And then another structure close to the superior vena cava, and I'll outline that in blue. Keeping in mind the flow of blood through the heart, what chambers are connected to those vessels? The superior vena cava brings deoxygenated blood to the right atrium, while the pulmonary arteries bring oxygenated blood into the left atrium. Therefore, we've identified the beginning of the left atrium. I'll just relabel those quickly. Whoops. And the right atrium. Let's orient ourselves and think back to what structures we have seen so far. We've reached two chambers of the heart, so we must be about here on our CT image. I'll draw a line through our cartoon right now. Keep in mind that on this cartoon image, you can't see the left atrium. It's actually more on the posterior aspect of the heart. So far in this presentation, we have identified the ascending and descending aorta, the superior vena cava, the right atrium, the left atrium, and the pulmonary trunk and both pulmonary arteries. We still have to find the left and right ventricles. We're going to scroll through a lot more slides until these chambers of the heart sort of enlarge in our images, and it becomes a lot easier to identify the chambers. The interventricular septum is starting to come into view, which is a very high yield structure, and I'll outline that in blue right now. We will see it elongate and become even more defined in the next few slides. This is the second high yield image I'd like to spend time on. You can see all four chambers of the heart in this image, as well as the interventricular septum. So let's go ahead and identify the four chambers of the heart. First, we're going to start with the left ventricle, label that LV. We have the left atrium, the right ventricle, and the right atrium. Something I'd also like to point out are these faint lines here, and I'll just roughly circle them. There are some in this area and some in this area. These are actually the bicuspid and tricuspid valves. Remember that the bicuspid valve lies between the left atrium and ventricle, while the tricuspid valve is between the right atrium and ventricle. Let's go ahead and orient ourselves where we are on our cartoon image. Again, we scrolled through a lot of images until the chambers of the heart looked like they were at their largest, so I'm going to draw a line right through the middle of the heart, like so. From here, as we continue inferiorly, we will see the chambers of the heart become smaller and start to disappear. Therefore, there won't be any more structures to identify once we move past this image, so I'll finish scrolling through this image set relatively quickly. However, I do want you to notice how the left and right atria disappear first in the next few slides. The left atrium has disappeared. And now the right atrium has disappeared. All we are left with are the left and right ventricles. Let's orient ourselves quickly. Remember, we can only see the right and left ventricles. So I'll draw a line showing approximately where we are. The next images will show the ventricles disappearing. And this concludes our image set. Thank you so much for watching, and I hope you found this presentation helpful.